Medicare is confusing on its own, but one of the most confusing things when people first join Medicare is all the different premiums that have to be paid to the different Medicare companies or different Medicare locations. So in this video, I want to share some shortcuts with you as to how to pay your premiums. Because the thing is this, if you don't pay your premiums, your plans can be canceled and it can be an absolute disaster to get them back. So let's get really clear on some shortcuts to make the premium aspect and how to pay your premiums so much easier. I'm Emily with the Medicare Coach. We are an independent Medicare consultant helping you navigate both the insurance company options and the Medicare rules. We are not an insurance company, an agent, a broker, or even the government. We are truly independent, helping you be your advocate as you go through Medicare. And I'm going to have some extra resources down below to give you some more inside tips to make Medicare even more simple and easy. So let's talk about how do you pay your premiums? I know it sounds silly, but the thing is, most of us, when it comes to health insurance, you've had your health insurance premium just come directly from your paycheck in most cases, and therefore it's pretty straightforward. But when it comes to Medicare, we have premiums kind of all over the place, and they go to different places. Initially, you have your Medicare Part A and B, which the premiums are paid directly to the government. Now, most of you pay nothing for your Medicare Part A, but most of you will pay something for your Medicare Part B, okay? So how can you make sure that you pay those premiums? Because having your Part B canceled can be an absolute nightmare. There's, I think, two things to at least be aware of. Number one, if you are drawing Social Security, your Part B premium will automatically be deducted from your Social Security check. So there's no extra steps required to pay your Part B if you're already on Social Security. But if you're not on Social Security, they're going to be sending you a bill. And those bills tend to be quarterly, which can look a little bit large. So if you're not drawing Social Security, an option if you don't want to pay those quarterly bills is to enroll in what's called Medicare Easy Pay. And when you enroll in Medicare Easy Pay, they number one, turn your quarterly payments into monthly payments, which is quite nice for most people. And two, you can set up an auto payment to get those paid every single month. So it's kind of like an auto draft and you're ready to go. Otherwise, sure, you can have those quarterly bills sent to you and pay those bills manually. I do not recommend, though, that you miss your Medicare Part B payments. Again, it can make an absolute mess to get that Part B coverage back at a later point in time. Now, we have other types of coverage, with the next being Medicare Part C as in Medicare Advantage. So if you have a Medicare Advantage plan, some will have a zero premium, so there's no premium to pay. But if you have an Advantage plan that does have premiums, you can either have that taken from your Social Security check, or you can pay that monthly or annually as well. Talk to the insurance company, but again, please do not miss your premiums. There is a window where you cannot make payments before your plan is canceled, but once your plan is canceled, it's an absolute nightmare. And usually moving addresses and forgetting to update your address is not an excuse to miss those premiums, so be on top of those premiums. Now, Medicare Part D as in drug coverage, many of those also have a $0 premium, so in that case, you have nothing to pay. But if you do have a premium, there's a couple different options. If you're drawing Social Security or railroad benefits, that monthly premium can come directly from that benefit, okay? Or you can work with the insurance company directly through your Part D plan and have those payments set up on auto draft, or just pay it once a year and be done with it. Many of those Part D premiums are quite small, and so paying on an annual basis can be very simple for many people. Now, the fourth type of plan is your Medicare Supplement plan. And those plans are also through the private insurance companies. And those will always have some sort of premium. Now, you will work directly with that insurance company, providing you your Medicare Supplement, also called your Medigap plan, to make those payments happen. Some of those companies will actually offer you discounts if you set up your automatic deposit every single month. So work with them, but again, please do not forget to pay your Medigap premiums. It's confusing, right? Because Medicare Part A and B go to the government, and then your other ones can go to an individual Medicare insurance company. So please be thorough, get those payments made to avoid your plan being canceled. For more inside tips, follow along to get the inside tips to make your Medicare simple and easy.